COVID-19 cases continue to slow down in some Asian countries as vaccination have been ramped up by health authorities. Here are the details.
Japan's COVID-19 cases have suddenly plummeted to their lowest in almost a year as the country mysteriously became a COVID-19 success story at a time when other Asian neighbors are struggling with increasing infection rates. According to reports, the new daily cases in Tokyo plummeted to 87 on Monday, the lowest record since November 2, 2020. This is also a sudden decline from the average daily COVID-19 cases of 5,000 during Japan's COVID-19 wave in August. The world is baffled over the sudden drop as bars in Japan are packed and trains are now crowded. Reports say that some possible reasons behind Japan's COVID-19 success include their fast-tracked vaccination campaign, imposing curfews on entertainment venues, and the widespread practice of wearing face masks. Experts also believe that the vaccination rollout among younger people brought the COVID-19 daily infections to drop, as nearly 70% of the population is fully jobbed. Prime Minister Fumio Kishida earlier said that his government has a preparedness plan that will be compiled by early November, and it will include tougher restrictions and require more hospital staffing, though he did not give an elaborated detail. 以上、日本から世界中からニュースをお伝えしました。SMNI ニュース Japan.
Cambodia's COVID-19 cases have dropped below 3,000 and also the 90th consecutive day of dramatically lower cases of COVID-19. Cambodia's on Tuesday recorded 175 new COVID-19 cases, bringing the national tally to 117,035. The total number of community cases in Cambodia is now at 97,636, with 19,399 cases being reported. 271 recoveries were also recorded as active cases continue to fall, and to date, there are only 2,927 active COVID-19 cases in Cambodia. Meanwhile, the country also recorded 11 new deaths, increasing the death toll to 2,681. Rika Pekongsimip, Kumedia Escobar, Podomin, SMNI, Cambodia.
Sabay Laos has recorded lower cases of COVID-19 in the Vientiane capital. The Health Ministry has recorded 285 new cases of COVID-19 across Laos, with 83 cases coming in Vientiane. Of this number, 280 cases were of community spread, while 5 are imported cases. The COVID-19 task force also reported 3,637 were conducted over the last 24 hours. Laos now has 7,005 active COVID-19 cases with 40 confirmed fatalities and 32,314 total cases. Butlaingan Komuni Vientiane, Patalaw Komunakan Jane Terza, SMNI News, Laos.
The ongoing efforts made by Australia's flying doctors helped thousands of people living in remote areas to receive COVID-19 vaccines nationwide. Australia's famous Royal Flying Doctor Service is one of the largest and most comprehensive aeromedical organizations worldwide. The organization plays a critical role in the country's ongoing vaccination rollout by transporting COVID-19 vaccines to remote areas. The initiative helped thousands of residents save a lot of time, money, and effort, as well as escape long lines just to get vaccinated. Most importantly, it would help residents acquire enough protection from the virus, considering that it will take hours for them to reach the nearest hospital once they get infected. Australia's flying doctors already helped 50,000 people living in hard-to-reach areas to get vaccinated against COVID-19 as of date. Reporting from New South Wales, this is Devi Suarez, SMNI News, Australia.
Effective on Tuesday, October 19, international vaccine certificates required for Australians to travel abroad will be available online. The certificate will serve as a proof by border officials worldwide that the traveller has been fully vaccinated against COVID-19. Travellers just need to visit MyGov website to request and download the document. The International Vaccine Passport is equipped with QR code that can be easily scanned by foreign authorities. The announcement was made after nearly 70% of Australians are now fully vaccinated against COVID-19. The Australian government is hoping that vaccine passports will help boost economic recovery as it plans to relax more international border restrictions. Reporting from New South Wales, this is Gillian Libowit, SMNI News, Australia.
Anti-vaccination demonstrations have erupted in Italy as the government's mandatory Green Pass for all workers takes into effect.
With this, police forces and other security personnel were deployed, especially in the capital Rome, while schools also ended their classes early, while embassies issued warnings of possible violence since protests could turn violent again. Meanwhile, the new Green Pass rule makes employees to show their pass in order to enter to their workplaces to prove that they were vaccinated, has recovered from COVID-19 in the last 6 months, and or has recently tested negative. And if they don't comply, both employees and employers risk fines, while the public sector workers can be suspended if they show up 5 times without the pass. In fact, Italy now requires visitors the Green Pass to enter museums, theaters, gyms, and indoor restaurants, and for boarding to long-distance trains and buses or domestic flights.
Meanwhile, Prime Minister Mario Draghi has repeatedly defended the health pass, noting that the move aims to prevent further lockdowns in Italy, which is one of the hardest hit by the pandemic among European countries. Portandovi sempre nuove notizie dall'Italia. Sono Dindo Perez, SMNI News.
Italy's requirement that all workers be vaccinated shows it is willing to use the full leverage of the state to try to curb the pandemic and get the economy moving.
With this step, Italy, the first democracy to quarantine the town and apply the blockade of the country again, first crosses the new threshold, uses the state's full power to curb pandemics and move the economy. Italy's new measures, which require proof of vaccination, a negative swab test, or a recent recovery from COVID-19 to go to work, now balance public health needs with concerns about civil liberties. It stands as one of the toughest of the Western democracies struggling to take.
As for vaccinations in Italy, more than 80% of people aged 12 and above are now fully vaccinated.
Portandovi le nuove notizie sono Sunshine Smith, SMNI News, Italia.
Following weeks of speculation, the U.S. announced late Friday that it will accept mixed vaccinations with new regulations requiring foreign travelers entering the U.S. to be completely vaccinated take effect on November 8. Individuals who have received any combination of 2 doses of a COVID-19 vaccine that has been approved by U.S. authorities or the World Health Organization will be deemed fully immunized. Moderna, Pfizer, AstraZeneca, and Covishield, an Indian-made vaccine, are among the World Health Organization approved vaccines. As a result, travelers who have received any combination of these vaccinations will be able to enter the United States. Air travelers will also need to provide confirmation of a negative antigen or molecular test performed within 3 days of boarding their trip to the United States, in addition to proof of immunization. Canadians who arrive by land will not be required to take the COVID-19 test. All non-essential land and air travelers must have a negative molecular test before returning to Canada. Canadians day trippers to the United States have been concerned about the return test. No matter how brief their journey, they will be responsible for a costly molecular test, which may cost between $150 and $300 and take up to 24 hours to complete. To avoid waiting for test result, the federal government has stated that Canadians can take their tests in Canada, go to the United States, and then return using the same test as long as it is less than 72 hours old. Reporting from Windsor, this is Krisha De Vera, SMNI News, Canada.
The Bay Area's tourism industry is preparing as COVID-19 travel restrictions will be lifted for fully vaccinated international travelers on November 8th. The global pandemic and U.S.-imposed restrictions took a heavy toll on international passengers in the Bay Area. But airlines have now seen an increase in international ticket sales in recent weeks after the White House announced plans to lift the restrictions. According to San Francisco International Airport spokesperson Doug Yackel explains, SFO has one of the largest slices of international activity at any U.S. airport. Pre-pandemic, about 25% of all of our passengers were international.
Nick Callio, chief executive of the Airlines for America Industry Trade Group, said in a statement that the full reopening of international travel is also critical to reviving economies around the globe, reinvigorating communities, and supporting millions of jobs in the U.S. and abroad. The new policy allows for all FDA-approved and authorized vaccines, as well as the vaccines the World Health Organization has approved for emergency use, to be accepted. Travelers must also show a negative COVID-19 test taken within 3 days of the trip. Although the U.S. had previously limited travel along its borders with Canada and Mexico, the new rules will allow fully vaccinated visitors to now travel for non-essential reasons to cross U.S. land borders. This is Dana Nuki reporting from San Francisco, California. SMNI News, USA.
79 Cuban medics will be deployed in county hospitals of Kenya on October 25. It was in 2018 when the first batch of Cuban doctors arrived in the country as part of the implementation of an agreement signed by Cuba on 2017. According to the Council of Governors, Chairman Martin Wabora, the Cuban specialists have completed the induction of Kenya School of Government and will be deployed in due course. The governors have refuted claims by the Kenya Medical Practitioners, Pharmacists and Dentists Union that the Cuban doctors were employed at the expense of experienced doctors in the country. KMPDU had previously accused the government of bypassing its own medics and opting for foreigners. It had demanded employment of 1,000 jobless Kenyan doctors as well as ramping up county's medical workforce. The union lamented that the country is paying the Cuban doctors handsomely while there are over 2,000 Kenyan medics who are unemployed. Aliyewaripotia ni wenu Richard Musyoka, SMNI East Africa.
Subscribe to SMNI News Channel and turn on notification button for more news updates.